On this Tuesday night, how prepared is Canada for an epidemic of COVID-19? The strain it could put on hospitals.
It's like a bomb that explodes, but it keeps exploding.
As a doctor in Italy sounds the alarm about the dire situation there, a country under lockdown. Plus, drastic new measures are taken in a New York suburb.
This is literally a matter of life and death.
And more public events get canceled. Touchy subject.
Oh.
How to keep your distance when you greet, now that handshakes, hugs, and kisses are on hold.
No touching! No touching!
And when reliability is on the line, what Via Rail admits is a serious embarrassment.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin tonight with the impact the coronavirus is having around the world and here in Canada. There are multiple developments tonight. The number of deaths in Italy shot up today, and doctors there have some dire warnings. And tonight, dozens of Canadians who were on board the Grand Princess cruise ship are back in Canada, settling into a quarantine facility in Ontario. 228 Canadians were on a government-chartered plane to CFB Trenton. They were tested for signs of the virus before boarding, and they'll spend the next 14 days in isolation. Not on that flight, several Canadian crew members from the Grand Princess who tested positive for COVID-19. The government didn't specify how many are sick, but we know at least 19 crew members and 2 passengers did test positive before that ship docked in California yesterday. There are now 93 known cases of COVID-19 in Canada. 4 are in Quebec. There are 7 new cases in Alberta, bringing the province's total to 14. Ontario has 36 cases. There are 7 new ones in BC for a total of 39. And 2 of the new cases there are healthcare workers from the nursing home in North Vancouver, where a man in his 80s died of COVID-19. The risk in this country does remain low, though public health officials say to slow the spread, now is the time to practice social distancing from other people and to stay home if you're sick. And late today, that's what the Federal Minister of Natural Resources, Seamus O'Regan, tweeted he is doing. He says, I've had a persistent head cold for a few days, so as a precaution, I saw a doctor. They recommended a test for COVID-19. I'm not aware of contacting anyone infected, but was told to remain in self-isolation until we get the results. Feel fine, but I'll work from home. And tonight, a British politician announced she's tested positive. The minister in charge of patient safety, Nadine Dorries, is now self-isolating. Officials are identifying anyone who came in contact with her, including other MPs. She recently met hundreds of people and attended a reception with the British Prime Minister. What's happening in Italy is a warning to the rest of the world not to be complacent. The death toll in Italy jumped by 168 in just 24 hours to 631. More than 10,000 people have now tested positive in Italy. The entire country, 60 million people, have been told to stay home. And one doctor is exposing the chilling reality. Dr. Daniel Maccini says it's like a tsunami that has swept us all. He works at a hospital in Bergamo, northern Italy. In a translated Facebook post, he says, I understand the need not to create panic, but when the message of the dangerousness of what's happening does not reach people, I shudder. Cases, he says, are multiplying. We arrive at a rate of 15 to 20 admissions per day, all for the same reason. The results of the swabs now come one after the other. Positive, positive, positive. Suddenly, the ER is collapsing. Every ventilator, he says, becomes like gold. Today, Air Canada canceled all flights to Italy, and the coronavirus is now present all across the European Union. Crystal Goomansingh on how the worst-hit country outside China is coping.
Italians are seeing firsthand the consequences of the new coronavirus, and it's overwhelming.
When it came out in Wuhan, we were all watching the news. We were thinking, oh, geez, that looks terrible. And then it started to come home to us.
Margot Leggett-Bellani is Canadian but has been living in Italy for 15 years. She has friends who are doctors, and the explosion of COVID-19 cases has changed her view.
I think it will become a very big problem. If it spread that quickly in Italy, it can spread quickly anywhere. It's not just where we are.
About a week ago, the government shut down all schools, universities, plus theaters and museums. It wasn't enough. On Monday evening, the nationwide ban was announced. Some travel is allowed, but only for specific reasons, and paperwork is required. People are also being told to stay at least a meter away from each other, and public events such as funerals and weddings are canceled. Now, grocery stores are open, but not on weekends when crowds would be larger. European leaders met today by teleconference based on Monday's confirmed cases with 463 deaths and 9,172 infections. Italy's fatality rate is at 5% nationwide. That's higher than the 3 to 4% fatality rate from COVID-19 being reported in other countries.
Everything is very quiet except for, it sounds really terrible to say, but just when your ambulances going by, it's this very almost creepy feeling.
The man considered patient 1 in Italy is 38 years old. He's said to have recovered. It's a bit of hope for frontline staff fighting the epidemic. Crystal Goomansingh, Global News, London.
So how ready is Canada? What would an avalanche of severe respiratory illness cases mean for our healthcare system and our hospital emergency rooms, many of which are already over capacity? That's what Heather Yourex-West is looking at tonight.
Inundated with calls Monday, HealthLink, Alberta's telehealth hotline, was unable to keep up.
HealthLink is experiencing very high call volumes due to COVID-19.
Many who called the line heard this recording. Officials say more staff is being trained to deal with the growing demand. In BC, public health physicians have been brought out of retirement to help with testing and containment measures. Canada's health system showing signs of pressure, even though compared to other countries, Canadian cases of COVID-19 are relatively low.
We had to completely reorganize the hospital networks.
In Lombardy and northern Italy, the healthcare system is under siege. Intensive care units have been struggling to care for more than 600 who are now critically ill because of COVID-19.
It's not the disease itself, it's the amount, the incredible, overwhelming amount of patients you have to take care of in a limited amount of time. It's like a bomb that explodes, but it keeps exploding day by day.
The numbers seen in Lombardy are staggering. 12% of positive cases are ending up in the ICU as staff struggle to find beds.
It's more likely that ventilator shortages will come in before ICU bed shortages.
Patrick Saunders Hastings co-authored an audit of Canada's pandemic preparedness level 3 years ago. He says despite lessons learned from SARS and H1N1, Canada's health system may not be ready for something as contagious as COVID-19.
From a surge capacity planning point of view, we often recommend hospitals work at about 85% capacity, and I don't think it will surprise people to hear that most work well above that, in the range of sort of 100 to 120%.
The federal government says it will help all provincial and territorial health systems deal with additional pressures in the coming months. But for now, the focus remains on ensuring this virus doesn't spread. In Italy, Dr. Criselli agrees taking precautions now to contain COVID-19 is key.
The only way to survive this, the only way to avoid thousands of deaths, is to stop the spread of the disease.
Heather Yourex-West, Global News, Calgary.
The federal government is under pressure to be ready to respond to healthcare needs and with economic measures. Our chief political correspondent David Akin has been tracking one meeting of cabinet ministers after another on Parliament Hill today. David, what preparations are being made?
Well, there's going to be lots. Now, Prime Minister Justin Trudeau had a 3-hour meeting with his full cabinet today. He spent another hour with that cabinet subcommittee on COVID-19. And he emerged at the end of all of that to say there is broad agreement that the Canadian economy is about to slow. Indeed, economists now expect the GDP to shrink by 3% or more. That's a lot between April and June. And so his government will soon be announcing some steps to cushion that blow.
We recognize that there are going to be significant economic impacts for Canadians, for workers, for businesses, and that's why we're going to be talking very soon about measures that Canada is going to put forward to support people on the economic side.
Now, how soon is soon? We do expect some measures to be announced tomorrow, and then we may hear some more measures at the conclusion of the First Minister's meeting that Trudeau is going to convene later in the week. We have premiers and territorial leaders coming to town on Thursday.
David, the premiers are expected to ask Ottawa for economic help, but they're also going to have a list of things they need for their healthcare systems. What do we know about that?
That's right. We know that Ottawa is under pressure to make sure that provinces have enough equipment for frontline healthcare workers.
Now, doctors are sounding the alarm over the shortage of ventilators we'll need in the event of widespread infection. Yet, it was just yesterday that this government wrote to premiers to find out what their needs are. That is a failure of emergency preparedness.
Davies is referring to a letter Global News obtained over the weekend that was signed by the Prime Minister, addressed to all the premiers, and asks them to come to this week's First Ministers meeting with a list of supplies the provinces need. Now, the idea behind all that is it is the federal government that is in the best place to make a bulk purchase of those supplies and then distribute them where they're needed. Donna?
Okay. David Akin in Ottawa. Thanks. In the U.S., the governor of Washington state is putting new measures in place after a COVID-19 outbreak at a nursing home north of Seattle. All staff and volunteers working at nursing homes and assisted living facilities across Washington state will now be screened for symptoms at the start of each shift. Visitations will be limited, and visitors will also be screened as they enter. Other states are also limiting visitors to nursing homes. At least 19 residents at the Life Care Center in Kirkland, Washington state have now died. 55 other residents have tested positive, and 21 of them are still at the facility. Across Washington state, there are at least 267 confirmed cases of COVID-19 and 23 deaths. One of the other outbreaks in the U.S. is just outside New York City in Westchester County. A containment zone is in place now. New York City's mayor says private labs that began running coronavirus tests on Friday are reporting so many new cases, public officials are having trouble keeping up. There are more than 950 known cases in the U.S. now, at least 28 deaths. Today, President Trump assured Americans the virus will go away and everyone should remain calm. Abigail Bimman reports.
St. Patrick's Day parades in Seattle, San Francisco, and Boston canceled.
Really thinking about protection of people.
The list of events keeps growing. Santa Clara, California issued a county-wide ban on large gatherings, putting San Jose Sharks games in jeopardy. New Jersey saw its first death. And New York announced a 1-mile containment zone in New Rochelle, where there has been a cluster of more than 100 cases.
We're also going to use the National Guard in the containment area to deliver food to homes, to help with the cleaning of public spaces.
Harvard is the latest university to cancel in-person classes, asking students to move out of dorms. Meanwhile, on the Grand Princess cruise ship, while the healthy Canadians left, disembarking all 3,500 people will take longer. Dual Canadian-American citizens Eva and Ron Weisberger have launched a $1 million lawsuit against the ship's parent company, alleging it didn't adequately screen or warn passengers about the threat.
Anybody who catches coronavirus and has a severe heart condition like I do, it could be fatal.
The cruise industry, along with airlines, have been hit hard.
They're two great industries, and we'll be helping them through this patch.
President Donald Trump also hinted at economic help in the form of payroll tax cuts and relief for hourly wage earners and help for people to get tested. The government has been criticized for its slow rollout.
These CEOs have also agreed to no surprise billing. We want people to get tested.
Meanwhile, Trump himself has yet to do it.
Well, I don't think it's a big deal. I would do it. I don't feel that any reason. I feel extremely good. I feel very good.
There are at least half a dozen U.S. lawmakers who have chosen to self-quarantine after they came into contact with someone who tested positive for the new coronavirus. And 2 of them came into contact with the president, including one who flew with him on Air Force One. Abigail Bimman, Global News, Washington.
China's president went to the epicenter of the outbreak there for the first time since it began more than 2 months ago. State media reported Xi Jinping flew in to inspect coronavirus control efforts. His visit coincides with the shutdown of the last emergency hospital set up in Wuhan to manage a surge in COVID-19 cases. China announced it had just 19 new cases on Monday, down from 40 the day before. We know you have lots of questions about this virus, and we want to try to answer them. You can send an email to your questions at globalnews.ca. Our Jeff Semple will consult experts to try to find the answers. You'll also find extensive information on our website. We have a special page dedicated entirely to the new coronavirus. That's at globalnews.ca/coronavirus. COVID-19 is affecting the Democratic presidential race. Coming up, what the frontrunners are doing to try to limit the spread. The frontrunners for the Democratic nomination have called off their campaign rallies in Cleveland, Ohio tonight because of the coronavirus, the first major disruptions to the presidential primaries. This is a pivotal time for Joe Biden and Bernie Sanders. They're trying to win over delegates in 6 states in what's being called Super Tuesday the 2nd. Both said they are heeding advice to exercise caution about holding large public gatherings. Both campaigns said they will decide on future events on a case-by-case basis in the coming days. Vladimir Putin, the Russian president, has opened the door to constitutional changes that would allow him to stay in power until 2036. Putin is 67 now. He's served 4 presidential terms and a stint as prime minister, dominating the Russian political landscape for 20 years. His latest term expires in 2024. If the Constitutional Court approves the change, and it's expected it will, Putin could remain in power until he's 83. Still ahead, lagging locomotives have Via passengers railing for change. As part of a global news investigation into rail service, we're looking at just how reliable it is. Trains have connected Canada for more than a century, but in the last few decades, a number of factors have started causing costly delays. Tonight, Megan Robinson looks at what's happening on and off the tracks.
There was a time when the fastest way from Toronto to Vancouver was by train, with railway stations at the heart of many Canadian cities. But timetables from 70 years ago show the cross-country trip has become 14 hours slower, if you're lucky.
You're sitting there going, what is going on here?
One trip in January 2018 from Toronto to Vancouver was 43 hours behind schedule. None of the westbound Canadian trains were on time that month, with an average delay of 29 hours.
We haven't invested in train travel, especially for people rather than goods.
CN owns the tracks Canada's only passenger rail service uses for the Canadian, the Toronto to Vancouver route, and says its other customers pay more than $250 billion to ship products like oil, grain, and timber every year. Passenger trains don't get priority on the track.
And those are the money train. They leave Halifax, they go to Vancouver and get off of their way.
While Via Rail trains wait, the delays have cost the company millions in expenses, like overtime for their employees who deliver bad news to passengers.
I'm 55, I retired, lucky me, but I could have gone another 10 years. But I cannot sustain this I'm sorry, I'm sorry, I'm sorry, I'm sorry, I'm sorry, I'm sorry, constantly.
About 10 years ago, the Canadian was on time 84% of the time in both directions. But then, things started to go downhill. Just 8% of trains on the route were on time in 2017, with a small increase the following year.
I have to plan to lose a day because of how much I have to pad my schedule with all the delays that I can encounter. So one of the last trips I took, I just expected a 12-hour delay. That was just normal.
In a recent report, Via Rail says the situation is a serious embarrassment, and the performance of the Canadian should serve as the canary in a coal mine for what will happen sooner or later on its busiest routes in Ontario and Quebec if no action is taken. But Via Rail isn't just worried about delays. It also warned without improvements, it can no longer offer viable passenger rail services, which could help reduce traffic and pollution from cars and planes.
If we want train to be a real viable alternative for people to get around, we have to make sure that there's lots of ways to live near the train, there's lots of places to go that are connected to the train.
The federal government says it's reviewing the situation. CN spent billions of dollars in recent years to reduce congestion on tracks, but passenger delays persist.
I can understand a breakdown, I can understand irregularities, but for us to be held up on the tracks like that, given zero priority, you felt like you were being shuffled around like cattle.
Some train advocates have been calling for a new law that would give Via Rail more power and make it easier to punish companies causing delays. But the federal government tells us they're not considering it. Megan Robinson, Global News, Toronto.
And tomorrow we look at the federal government's track record on investing in rail and a new commitment on better connecting Canada's 2 biggest cities. Next, how the world is fighting off the virus by shaking off handshakes. Well, you know, by now the handshake is on hold as COVID-19 continues to spread. So are hugs and kisses and nose rubs. Keep your distance is the new mantra. Tonight, Mike Lakatura looks at the creative ways people are finding to say hello and goodbye.
stoppen we met handen
With
schudden.
COVID-19 spreading across the Netherlands, Dutch Prime Minister Mark Rutte announces a countrywide ban on shaking hands and then does this.
Oh, sorry, dat mag niet meer. Sorry.
The country's top doctor points out the mistake, so Rutte asks for a do-over, while actually getting closer than a handshake.
Dat mag dus niet meer.
The royal family, known for being slow to abandon tradition, is instead adjusting. Prince Charles greeting with a bow and pressed hands instead of pressing the flesh, while Prince Harry opted for the forearm bump. Last week, British Prime Minister Boris Johnson refused to shake the handshake.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
But he's said to be reconsidering the practice. After all, the handshake is such a part of politics. Now, Deputy Prime Minister Chrystia Freeland mixed it up at the Ontario Liberal Convention last weekend. Ottawa's mayor is still shaking hands as he toured the city's Chinatown to counter some discrimination being felt in that community. And Jim Watson admits these are difficult times.
We're in this sort of awkward position. Sometimes people will give you a hand and then they'll give you a fist bump, and someone was giving me an elbow. So I keep Purell in my car, I keep Purell at my desk, and I use it as often as possible. And so far, so good.
Good advice, according to health officials.
I think if you are completely well, then there's not really much risk of shaking someone's hand that is also well.
But sometimes it's hard to know if the other person is healthy or not, which has given birth to the toe tap or foot shake, done here by Russia's energy minister and OPEC's secretary general. Two members of the Philadelphia 76ers started their own special shake, virtual hand sanitizing. A good option, but instead, they should probably be doing the real thing. Mike LeCouteur, Global News, Ottawa.
That is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is Saskatoon. We'd love to see Your Canada. Please email it to us. And thanks for watching. Hope to see you here again tomorrow. Bye-bye.